I know she doesn't have a lot of time, so we're going to get Department of Public Health Social Services Director Linda DeNorcey on the line. Good morning, Linda.
Good morning.
So I guess my question, and Bree's got her questions, but I wanted to know, so we've retooled who we're testing. We're now limiting testing to priority groups. How far along are we in these priority groups, and how many more days do you think it'll take us to finish testing the priority group?
Right now, we've been very current with the priority groups. As far as the priority groups, as you know, this was made up of the Governor's Advisory Council group. That included not only public health, but also the Guam Memorial Hospital, the Guam Regional Medical City, and also private and adult and pediatric medical clinics, and the Health Professional Licensing Board. And so in response, this group prioritizes the way all these tests are going to be done. For one group, it would be the hospitalized patients and those patients that are in ER with all the COVID-19 symptoms. And of course, we know they're already sick, so early identification of them will ensure that we keep our hospital safe. And then the second category of those group is all the people that have chronic conditions and they have COVID symptoms. For example, those are people with diabetes, they have cancer or COPD, or they have any advanced kidney disease and others. Of course, we know that these are high-risk groups, and they're very ill, so even if they're so ill that they may die of the COVID infection, so they need to be diagnosed as early as possible. The third group, Chris, are the healthcare workers and the first responders, only those with COVID symptoms. That's the third category of the group. And the final is the older group with symptoms of COVID. And it's very clear that older people, as you know already, those that have COVID-19 get much more sick, and they get sick at a faster rate than those that are younger folks. Mm-hmm. So those are the four categories, just to let you know that. So
Linda, so are you able to tell us for each of those categories, since we started the limiting testing of the priority groups, how many positives have we had for each of those categories? Okay, where applicable?
Yeah, I can give you the total of all the positives that we have so far. We just did a test yesterday. So the test yesterday, we tested 40. That's the most updated. And of those, we had 2 that were positive. The last week, can I just tell you, in this category of individuals that were tested yesterday, we had 40 tests done. And of those 40, we had 3 that were positive. And
did you say 2 or?
All three were from GMH, yes. And so those of the 3 were in the high-risk group, okay? Those that are hospitalized. So this group was recreated so that we can really prioritize the order of that.
Yes. So
as we stand, that was just recently done yesterday. In the evening, the results came out.
Linda, are you able to tell us if we had any hospital staff, first responders in that category? Have we had any positives there?
As far as the first responders, I don't have that information as far as right now with me, but I can get it for you as far as that's concerned, because we have a lot of people that have been tested, as you know.
Right, Linda. And so what I'm thinking is that with these priority groups, these positive results are more alarming, probably because these people are already suffering from pre-existing conditions and maybe even comorbidities, right?
Yes, that is correct. And that is the reason why we're making it them in those categories, as I mentioned earlier.
Right. And so we had talked to some of the doctors yesterday, and we understand that there's a backlog of tests that need to be conducted, and these tests are coming from had come from like the clinic. So somebody exhibiting the symptoms, they go to the clinic, they get swabbed, but we're not doing those tests right now, right?
For the testing that we're doing, we're getting not only them from the hospitals, but we're getting them from all the private clinics and so forth. And right now, to answer your question, yesterday we had tests that had to be run. So we had 12 more to be tested. And then, of course, as the day goes by, more and more keeps coming in. So right now, we're looking at getting all caught up. I think we just have a few more and maybe about close to a dozen more left to do that. But we have added on additional staff from Guam Memorial Hospital that are being cross-trained in doing the testing. So we started off running 20 tests in the beginning, and then now we're doubling that. So we're doing about 40 tests every day from here on out.
So Linda, just to clarify, are we only running the tests that are for the limited priority groups, or are we also running tests from clinics that don't necessarily fall into those categories of the priority groups?
Right now, everybody will turn in all types of swab, whether or not they meet these 4 category groups. And what we have is a team that prioritizes which ones are going to be which ones meet the 4 categories.
Right.
So the answer to your question is we will accept all nasopharyngeal swab, and of course we're going to focus on the priority, meaning they're going to be run first, and whatever we have remaining that we can also run, we will take the next swabs that come in, even though they don't meet the top 4, but we focus first on those top 4 as the priority.
Is there a backlog? Because Dr. Cabrera said that there was a backlog of tests that aren't in the priority groups.
Yes, there are actually 12 that we have that
Okay.
are there, but it still remains there because, again, we try to focus on the top priorities.
Okay, I did want to ask, because we've been following the numbers with that are coming out of the Joint Information Center, and they weren't adding up last night from the 190 that tests performed to date. That was released on Monday. I'm sorry, 190 tests conducted as of Monday, and then Tuesday it jumped to 233, but it didn't add up from the 190 plus the 38 that was in the Joint Information Center press release. Or
yes, the Joint Information. Well, my information as far as of March 23rd, without including that I mentioned yesterday during the news media, the total tests performed was 230. But those are inclusive of tests that are rerun. Sometimes they come out as inconclusive. So what that means is they have to be run again on the next day to either be determined as a positive or a negative. So our data right now, in terms of as of March 23rd, the negatives are 166, the positives are 29, and so that is the reason. And of course, the 29 that we have, we had to update that again, and we have done that, and we will be reporting that out again today.
There was also something that was mentioned during the press conference regarding when there was discussions about the quarantine facilities and the movement of passengers, but there was something that was said about an isolation facility, and we weren't talking about the SNU. Is there going to be a separate or another isolation location?
Yes, that is correct. There are 4 hotels that were identified, and what we have to do is to make one become an isolation room area. What that means is those are for the COVID positive patients that are mildly ill. They may be asymptomatic, that it doesn't require them to be either hospitalized or taken to SNF for acute care services. So that's why one of the hotels will be converted into an isolation facility.
Which hotel?
And
I ask that because we're able to say that the SNU is an an isolation location. So I would think that we would be able to identify which hotel is going to be used.
The as far as that hotel, I know which hotel it is. I think just because we're trying to protect the patients, we're trying to let you know that there is a hotel. We're trying to keep it, so that it is not quite. I have nothing to hide, but what I'm trying to say is we're trying to protect the individuals.
Right.
Are there. So.
Linda, what can you tell us about this whole naval hospital thing.
Yeah.
So, I mean, is it a question of semantics, or is it just that they're saying we don't have any cases at Naval Hospital because they technically don't, but
they're on isolation.
You guys tested DOD related personnel, and we had 2 positives, right?
Yes, that is correct. But one of the positives that was tested was included in our 29 data that we had a day on the 23rd. The other one was coming from the military, and they didn't test it through us. What they did is they go through San Diego, and they do the testing there. It's through a research laboratory. And so that information is kept separate from our data. So all in all, our data as of the 23rd was 29, and 1 was from the military, and we're still waiting for the report to come. We were just orally notified about it, and we're just waiting for the report to come in from them. So we maintain all the data that comes, whether or not it's from the military or the private clinics. All the data has to be reported to the Department of Public Health. So that's where we stand.
So let me just back that up. So you said that you can confirm that there, in fact, was 1 positive from on the military side.
Right, which we're just waiting for the report. It was orally told, but we were just waiting for the report.
When was it told to you guys?
Yeah.
We found out I was informed just yesterday when we had our meeting, because that was one of the things that we were discussing during our press release. Do you remember that?
Yeah.
We asked about that. So when I went back, I checked with my territorial epidemiologist to find out if there were any reports, because as you know, by law, they have to report that to the Department of Public Health. Any Class 1 or Class 2 diseases must be reported, and that's inclusive of the Naval Hospital. And so I asked the territorial epidemiologist, and she did verify that an oral call was made, but no written report has been submitted, and we're just waiting for that.
Okay, and that's already part of the confirmed tests that the Joint Information Center is releasing, or that will be included today.
That has to be included, but we're separating what's local in terms of what we do at the department, and then we're separating the military based upon, because it's not done by us, it's done by their research in San Diego. They have San Diego that does their testing. So we want to make it clear. So we'll put a footnote. I'm putting footnotes on the bottom, like, what are the total cases and how many are from the military.
Right.
So far it's just 1 that we know of verbally that was reported as of what my epidemiologist had told me yesterday. And the grand total then will be added onto that 1.
Linda, I had a question from a Facebook comment here. I don't know if you can answer it, but we talked with the family of Doring Jesus yesterday, and they told us that this is something we had heard, that in the event, God forbid, in the event someone dies from COVID-19, that they have to be buried or cremated within 24 hours. Is that accurate?
That is very accurate. And the reason for that is because it is an infectious disease. We want to make sure that it's contained and that it's not spread, and also to protect the funeral home employees and everyone else in the community. We have to ensure that does happen within 24 hours.
Is that a cost that's borne by the government, or does the family pay for that? Because the question was asked, what if we don't have the means financially, right?
Just like in anything that happens in the community, whether it's an infectious or non-infectious disease, if the family does not claim the body, then the government will have to, we at the Department of Public Health will have to take care of that.
But in the event, again, God forbid, someone does die from COVID-19, family can't afford it, does Public Health then pay for that?
Public Health has to be the one, because we're the ones that have to take care of the bodies in terms of providing the registrar for the death certificate and also issuing the burial permit for the funeral homes to bury the body.
Linda, just maybe a couple last questions here. Go ahead, Bree.
Oh, no, I wanted to follow up on the question that I asked during the press conference yesterday. And as you know, we're limited to the amount of questions that we can ask. And so I did ask that question about the about the emergency mandatory order when these passengers from the Philippines came in last week. They were given this paper and it said it's emergency or a mandatory emergency detention. And then before they were transferred over to the other quarantine facility in Tumon, they were given another form that said to acknowledge voluntary quarantine. And I wonder if you can explain why it went from emergency and then all of a sudden they're asked to acknowledge that it was voluntary.
Yeah, in this particular case, the voluntary form is issued first, and then after that we issue what is called the declaration for involuntary. It's a bit complicated in regards to...
Wait, but this was done in reverse. They were given the involuntary when they arrived, and then they were given the voluntary.
On the paperwork, is that what happened? Was it someone gave the wrong form first, or is it as simple as that?
Well, it's not that simple, because what happened was when the passengers came in from Hawaii, from Philippine Islands. The Philippine Islands, as you know, has been the hot spot that we've been having, right? A lot of transmission. As you know, there were many people coming in. We have already 5 cases of the Philippines. And so, like everybody else that we're trying to sustain, we're trying to make certain that in public health, what we're trying to do is we're trying to do the case contact follow-up and surveillance. And whenever we have all these other individuals coming in, especially we know that it's from a hot spot, we don't want to mix them all up with what we're trying to do in terms of are there any clusters of studies that we're trying to find out where is the index case, and from the index, the person where it originates from and how it's spread to other people. And so the decision was made that all the Philippine passengers coming from the Philippines, originating from the Philippines, had to do what is called a quarantine, that we really wanted to do what is called a mandatory quarantine, which is a bit different from the other passengers that are coming from, let's say, the United States. And the reason is because, again, there's a lot of cases that we were seeing coming from the Philippines. And so they were more or less the mandatory type of quarantine that we have, that is more like the involuntary, where we're going to have them.
No. I understand that. I'm just saying what I'm asking is that say, for example, I came in from the Philippines. I was given this piece of paper, mandatory involuntary quarantine, and I go into the quarantine facility at Days Inn. So I'm there, but then all of a sudden I find out, okay, we're going to be moved to Pac Star. At that time, I'm given this other piece of paper that says it's involuntary, and acknowledge it, sign it. So I'm wondering, why is it upon arrival you were given a paper and it says involuntary, and then you're given another paper that says acknowledge that this was voluntary.
Right.
And that's, Chris was saying, was there just a mix-up?
Probably what should have happened was the voluntary form issues, and then the order for declaration for involuntary.
Okay, so
so it was backwards. Okay, Linda, we get a lot of comments about the tests. I know that I think it was the press conference day before yesterday. You had said that we are trying to get to a point where we can do a lot of tests on a lot of people, right? And so where are we in terms of getting more tests?
Yeah, we will not deny any of the private clinics from doing a nasopharyngeal swab. Everybody should do it. The providers know what they're doing. We'll take it at our lab. So that was your other question. But they will be prioritized. So that's what I wanted to emphasize. Okay, that's why I mentioned that, because that was your question. Right. Now, the next question you asked was, I'm sorry, how soon will we...
Are we getting, just maybe run us through how many tests we're getting and when?
Well, right now we have a total left of the test kits that we have right now is, we're looking at 170 as of the 23rd, so I'd have to subtract the rest that recently was done yesterday to get you an updated count.
Right. So,
but I automatically asked yesterday my staff to request for another test kit. So we request like 4, but we don't get all 4 from the federal government, from CDC.
You mean like 400?
4 boxes.
4 boxes.
Yeah. So in each of those boxes, the total number after we do all the validation of the test kit totals to about 200 specimen samples in the box. After we subtract, the fact that we have to validate the kits as they arrive.
Right.
And so, so we're kind of like limited. This is the second batch that we receive. So every time we ask for 4, we only get 1. But I keep asking for more, and I keep asking my staff to request for that. And so far we've gotten 1. But just to let you know, we are getting some help, and as I mentioned during all our press releases, we've entered into a contract with DLS to do testing at both Hawaii DLS and also through Quest, which is an off-island through California. In addition to that, commercial labs are also producing some test kits, and so we are venturing with the Guam Regional Medical City with a Gene Expert machine is another type of machine that can be used to also do a test from a different source of test kits. And so this is a different type of machine which Guam Regional Medical City has ordered, and we also have this machine also at our Guam Department of Public Health. And so Dr. From GRMC is planning to move it to our laboratory, and so we can use the 2 other machines, one from them and one from us. It's called a Gene Expert in terms of conducting these tests, in addition to the ABI 7500 machine that we're currently using.
Okay. I sorry, I keep harping on the quarantine, but with all the passengers that are in quarantine, how many are there currently?
So far, I'm just going to give you data that I have so far as of March 22nd, and these are adding up more. We have a total of 241, and we're going to be updating that also. So far as of March 22nd. Okay. And I will be updating that, yes.
Out of the 241, have any of them started exhibiting any sort of symptoms of flu-like symptoms, COVID, and have any of them been tested, and have any of them tested positive?
Yeah, right now, none that I know or I'm aware of. Most of them have been coming for acute care. They just came from St. Luke's Hospital, so I know that a lot of them had they just got out of surgery, so they needed to be sent to the hospital, and those are the ones that I'm very much aware of that had to go to the hospital, and some had kidney dialysis that had to be taken care of, and they were just for patients that had comorbid conditions that had to be further evaluated. We do have, as part of our agreement, the Health Services of the Pacific, which has a doctor that is contracted with us to do all the screening for all the sites that we have, the 3 quarantine and 1 isolation sites. So they do that on a regular, everyday basis with the constituents that are there, the passengers that are there. And so to my knowledge, none of them, to my knowledge, was ill that it had to undergo testing for COVID at this point in time.
Okay, so when the 14 days expires, they get to go home.
Is that accurate, Linda? Because I thought you guys said something like after 14 days, there's another 7-day period or something.
There are new CDC guidelines that just came out. Okay. But yes, we cannot just let them go.
Okay.
We just have to make sure that the new CDC criteria, as the governor mentioned, the 7 days without any symptoms.
Right.
But there's also, we just found out that there's also a new release that came out at CDC, and I'm going to ask Dr. Thane to provide that to me, and I can share that with the community, because I know there's other guidelines that everything keeps changing with CDC.
Right.
I hope you understand
that. No, we do, Linda.
You know, every time we tell you one thing, it's another thing. So just bear with us because we're just following the CDC standards.
Yes.
But yes, the clearance has to be made. And once they go out of quarantine, we also have them complete a form, actually a form that is completed by the department that states that they have successfully completed the quarantine. And then that form is kept for our files, and we maintain all that record.
Linda, sorry, I just have to ask. Can I?
Go ahead.
Do you have another one? Because this is not COVID related.
Oh no, this is COVID related.
Okay, go ahead.
I wanted to ask about the home isolation because a lot of people have been concerned about that, including the mayors. And initially, it was reported that 9 were on home isolation and they were being monitored by public health, and it was only temporary because they were going to move them to Barragata Heights to the SNU facility. But then it came out that didn't transpire as far as we know, and it jumped from 9 to 20. And I'm just curious, where was the change? Why did this happen? And why did they initially say it was temporary and now it seems permanent?
Yeah, well, see, what happens is we've had some at home isolation. We had one that actually was home isolation. We transferred them to SNU. Of course, this was voluntary. We tried to convince everyone so that they understand there are drawbacks in this case. What happened was when we had 2 at SNU, in addition to that one that came from home isolation, the one that came from the hospital went to SNU and then reverted back to becoming worse, so that they went back to the hospital. So with the isolation at home, as long as their symptoms are asymptomatic, CDC guidelines tells us that if they're asymptomatic and they also have very mild conditions, and knowing that they don't have, they're not at high risk with comorbid conditions, that home isolation in accordance with CDC is sufficient. And then, of course, there's that possibility that they may become better or they may become worse. If we have to study everyone case by case. Everybody is different, and so we want to get them into this isolated area, and that's what we're trying to do right now. As we speak, I'm working with my team. Our surveillance and team is emphasizing that, and that is our mission, to do the movement from their home to the isolated area, as I indicated, one of the identified hotels.
Okay, Chris would like to ask a question.
Thank you, Sabrina.
Proceed.
Right, yes. Linda, we're getting a lot of questions about emergency food stamps. Where are we on that? I mean, people are hurting out here, Linda.
Yes, and I got the answer to your question. Yes, we were successful to get it extended. So we just got the report out yesterday, and I'm happy to report my incident command system has all that report that they give to me. And I'm happy to say that the SNAP, the Supplemental Nutrition Assistance Program, the extension waiver was approved from the Food Nutrition Services for 6 months. From the expiration date for March, April, and May 2020. So there is an extension for 6 months. So
okay,
I'm sure they're very, very happy to hear that.
Right, and so what does that mean for people out here, especially for people out here who don't normally qualify for that type of assistance?
Yeah, well, this one is for the SNAP. Those are that are already qualified.
Right. Right.
Yeah, but we're now looking into another emergency supplemental allotment for SNAP recipients. These are for some people that may be in need of it because they lost their jobs and so forth. So we're just trying to get clearance on that, as far as there's some clarification that needs to be done from FNS to ask about the guidelines in that particular emergency supplemental allotment.
Right.
So that's where we're going to get the guidance and clearance first, and then once we get that, then we'll let the people know whether or not we can include those that are not currently under SNAP, that they may be eligible because they've lost their job or their hours got cut or what have you. So that's what we're looking into as we speak.
Thank you so much, Linda.
That was a lot of information.
Thank you.
Thank you so much for what you're doing. I know you're probably getting maybe even 2 hours of sleep a day.
Right, yeah.
Three.
Three.
4, I'm lucky with 4.
Lucky.
I'm very happy with 5. So,
Yeah. 5 is like dream on.
Right. Thank you so much to
Thank
you and your
Linda.
staff.
Yeah.
Thank you too. Bye-bye.
Okay,
Okay,
goodbye.
take care.
Yeah, Linda DeNorcey, Department of Public Health, Social Services. You know, I got to give her a lot of credit.
She's dealing with a lot, just
she
not
is.
just the health side, and now she's dealing with the economic side.
Right.
And it's good to know that that is something that's on their radar with people, the rush of people they're probably going to see as a result of them losing their jobs. And so thank you.
I
Linda.
actually just wanted to give her credit because we had made to ask last night for her to call. We were told it might not happen, so I just called her myself, and she was like, "Man, maybe 5, maybe 10 minutes, Chris, at the most," because she's writing a report right now that's due, and she gave us 30. So
Thank you.
and that's the thing I really appreciate about Linda is if you catch her in a situation where she. Even if she doesn't have time to answer every question, she will definitely try, which is something you don't see in these Zoom press conferences because we're very limited on what we can ask. So we thank her for calling in and giving us more opportunity to ask these questions. 8:31, we're going to take a break, do news, and we're going to bring on the Legislative Health Committee Chair to maybe kind of unpack some of the things that Linda said and find out what she is working on. It's 8:30.